Good morning and good afternoon from all Commonwealth alumni across the world. Welcome to this panel discussion. Apologies. Today and at this time, we're gathering here to recognize the critical importance of fostering environments where every single student, regardless of their ability or disability, feels valued, supported, and empowered to thrive academically and personally. Our esteemed panel today brings together a wealth of expertise, experience, and insights from various perspectives within the higher education sector. Before we start, I would like to remind you to add any questions that you have into the Q&A section because the chat is disabled. So your questions will be monitored and answered at the end of the session. You can also, there is a button where you can activate, I'm just trying to see its captions at the bottom of your screen if you would like to use captions. And to start the session, I would like to welcome the chair of this panel, Sue from British Council. Over to you, Sue.
Thank you, Mace, for the introduction, and thank you for having me here as chair today. We have a quite diverse panel, and I'm looking forward for the conversation. Let me just introduce myself. I'm Sue Başbu. I'm working for the British Council. I'm the Equality, Diversity, Inclusion Program Manager for Cultural Engagement, which means that I'm working around all sectors, not only higher education, but arts, English, and education itself. And I support teams deliver more inclusive internal and external impacts around the globe, not only in the UK. And higher education is quite exciting around it because we are very committed to be as inclusive as possible and to create experiences for our international students that would be inclusive and welcoming for all of them. And today our panel is mostly focused on the inclusion of disabled students, and we have a panel that is quite diverse in terms of we have activists, we have medical doctors, we have directors, funders. So without further ado, I want to start the conversation, but I just want to have our panelists introduce themselves one by one, and over to you, Kenewe, to introduce yourself briefly on what you do.
Okay, thank you so much. My name is Kenewe Simpi from the Mountain Kingdom of Lesotho. I'm visually impaired and a disability inclusion advocate or activist. And for the past years, I've been advocating for equal access to information as a key to our
Apologies, Kenewe. I'm very sorry. We can't hear you. Is it just me?
Yeah, your voice is quite lower, is way lower than our previous conversation. Maybe there's something in front of the microphone, or the settings have changed.
Your apologies. Can you hear me now?
It's still a bit far, but I think it's a bit
better if I think it's better than the first instance. But yeah, if you
sorry about that. Thank you.
Okay. Can I continue?
Yes, please.
Oh, okay. Like I said, I'm sorry you couldn't hear me. I'm Kenewe Simpi from the Mountain Kingdom of Lesotho. I am visually impaired, disability inclusion advocate, and for the past years, I've been advocating for equal access to information as a key to attainment of quality education. I'm currently studying Master of Science in Inequality and Society at the University of Sunderland and the Commonwealth Master Scholarship. Thank you.
Thank you so much, Kenewe, for introducing yourself. And Rachel, could I ask you to weigh in now?
Thank you. My name is Rachel Inegbedian, and I have over 10 years experience in disability advocacy and policy and social development issues. I'm currently the founder and executive director of the Special Needs Initiative for Growth. It is a non-governmental organization that is focused on empowering persons with disabilities through the provision of resources and practical programs for meaningful living. And then we use demand-driven ICT tools and resources so that they can assess either inclusive vocational skills, employment, or entrepreneurship. I am also a Commonwealth Scholar alumna. My studies was in sustainable development in the University of St. Andrews in Scotland. And I'm currently a PhD student in Boston, University of Massachusetts in Boston, and I'm into global inclusion and social development. So I think I'll end here. Thank you.
Yeah, thank you. That was quite a huge background. Thank you for introducing yourself. And Juliet, over to you.
Hi, everyone. My name is Juliet Mulenga. I'm from Zambia. Currently, I'm an ophthalmologist who works at the Lusaka Eye Hospital. And I'm also an alumni of the Commonwealth Scholarship. I did my study in Masters of Public Health in Eye Care, and that was in 2021 to 2022. And I'm happy to be here, guys. Thank you.
Thank you. And yeah, thank you all for joining and spending this morning, afternoon, or night with us and sharing your valuable experiences. So I'll just jump into our questions, but just want to remind the audience that we have a Q&A session button below the screen where you can also add your questions. We will talk through 3 questions overall, but I mean, we want to hear from you as well. So we want this to be as informative and meaningful as possible for our panelists, but for our audience as well. So please don't refrain from asking your questions. And I'll start with Juliet Mulenga, Dr. Juliet Mulenga. The first question is more around practical, maybe support. So how do you think can higher education institutions ensure that their physical and digital environments are accessible to disabled students?
Okay. Thank you for that question. So I think I'll just give a general list of what higher education people should consider when trying to make the environment more inclusive. First of all, you need to understand the needs. It's very important that you are aware of what the people in your institution have different needs, require different avenues of learning. So it's mostly important to understand the needs. You need to choose the right tools that will be able to disseminate the information you want your students to learn. It doesn't make sense to have a tool that doesn't work for somebody who's, for example, visually impaired or hearing impaired. Of course, it's also important to design the contact in a way that is clear, consistent, it's flexible, and also has a feedback mechanism so that it's a two-way thing, not just a one-way thing from teacher to student, but from teacher to student and student back to the teacher. And I think it's also important to have a good communication with your students, to collaborate with them, and to review and improve upon what after they've used your systems which are available, you get feedback from them on how the systems can be improved. Yeah, thank you.
Thank you so much. Yeah, I think that designing mostly and involving disabled students into the design would really make a huge point and a huge leap forward. Can I ask the same question to our other panelists? So Rachel, what would you think around that? So how can higher education institutions ensure that they are inclusive in their physical and digital environments?
Well, I think, like she's added, I think it's very important that we move beyond, you know, the structures. So what I'll be thinking about is integration of peer support groups, where students with and without disabilities can learn from each other. I think that's very important because, again, they're able to pick good habits and good, you know, supportive learning community that really helps to value their lived experiences as students. And I also think that in that aspect, when we think about peer support, it really helps them to engage in a cultural, you know, and a dynamic environment where everyone can learn, irrespective of your disability. And I also think that in that context, we need to also have like regular feedbacks and some sort of mechanism where we assess and evaluate how they're coping with that peer-to-peer mentorship, because again, it really helps them to have an understanding of what it looks like, at the other side. That is when, they're able to interact more with non-disabled peers. So I'll be looking strictly at that. And then, like I said, feedback loops, assessments, and especially the assessment between special educators and, parents, as well as caregivers and the students with disabilities. So that way there's an ecosystem where the feedback is continuous and the progression for learning, is unending for them. Thank you.
Thank you so much. Can I get over to Kinewe for, again, going to the same question?
Oh yeah, thank you. I'm not sure if I'm audible now.
It's the same as before, actually. It feels like it's coming from a background rather than a foreground.
Yo, I don't know what to do now.
But I think that you're closer to the microphone. In the last word that you said was quite good. So if you could continue doing that, yeah.
Okay, can I continue?
Yeah, please do.
Oh, okay. I think what I wanted to add is that I think one of the things that institutions can do is to have clear guidelines on various types of disabilities, and the design and implementation of such should be made in consultation with people with disabilities themselves. Why is this important? It is important because people with disabilities have first-hand experience of the challenges they encounter when navigating physical and digital spaces, and their insights may provide important information on barriers they encounter and the accommodations required to address those barriers. Also involving them in the design process followed the principles of end user design, user-centered design, which prioritizes the needs and preferences of end users. It is very important because we don't want to come up or create solutions that are not tailored to the unique needs of the target population. Thank you.
Yeah. Thank you. I'm also taking notes. That's why I'm silent in some cases. Sorry. I want to move on to the second question again, but I think that in terms of what you all said is, first, include disabled students or people with disability experience into the design and the implementation of the whole educational system. Don't make assumptions. That I think that's really at the core of how to be more inclusive physically and digitally, because when we make assumptions, we tend to make wrong ones if we don't include the right people and the end users into the design. And the second one is around feedback. And I would want to go back to the feedback maybe towards the end of the conversation around, or maybe now if anybody has an addition to make, because I would want to hear around good experience of feedback, good systems where you either experienced or you build yourself on how to make this work. Okay, we have in the design, we have included people, but how does a good feedback system means or looks like in such a circumstance? So I'm not sure if anybody wants to weigh in now, or we could maybe embed it into the other questions and answers. But yeah,
I could jump in.
Yeah, please do.
Because I knew I talked about it briefly. So I think for us, I just want to give my NGO, like basically what we do. For us, we understand that it's not a one-size-fits-all approach, because teaching is, because if that is that way, teaching becomes ineffective for learners with disability. So we embrace a spectrum of teaching methods. And one thing that we do in terms of feedback is to ensure that we maintain a quality of diverse content. So for example, we try as much as possible to ensure that the educators and the parents can get to share the stories of their children's experiences. And that really helps to provide us a deeper insight than a standard feedback that we would have achieved. So we get them together, we get them to discuss, more like a town hall meeting, and we get to note those feedbacks, and keep that as data to use in terms of preparing our programs and projects so that we understand those rigorous areas where there needs to be improvement or not. Another thing, again, I would say is that we track the progress. So we track to adjust the methods that we use for the learners. So with the continuous loop of assessment, and then the feedback mechanisms through, conversations with the parents, like physical conversations and virtual conversations with the parents and educators, we're able to ensure that teaching methods that we use are not just diverse, but dynamically aligned with the students' learning journey, And, this has really helped us over the years because that way we're able to understand that students are able to thrive uniquely, across their various unique standards and their various unique learning challenges. So I think I'll stop here. And then if there's anyone to add more to this, thank you.
Any of our panelists would want to weigh in there or just jump in?
Yeah, I'll definitely
Yeah.
jump in.
Yeah, please do.
Yeah. I think feedback, giving feedback is really important. Where disabled students can provide input on their experiences and suggest improvements on accessibility and support services in general. Since I came here, I've seen a couple of module-based surveys that are meant to get students' opinions on how module content and tutors have been so far and what needs to be improved. But I haven't really seen a disability service specific survey. And I mean, that is equally important as seeking disability service specific feedback can help institutions to make some improvements where they've been lacking and to better meet the needs of students with disabilities. Thank you.
Thank you. I think that's a good point. And there's also a segue to our next question. But if Juliet, you want to add anything to this? No. Okay. So I'll move on to the next question, and I start with Rachel again. We talked about good examples of feedback mechanism, but it would be good also to hear if you know or you have experienced or again developed some successful examples of inclusive practices implemented in higher education to support disabled students.
Yeah, so I'll still go back to my nonprofit because basically most of this are practice here. So for us, we understand that, inclusion in higher education, it's not a matter of convenience. So it's a fundamental human right. So for us, we try as much as possible to partner with the local disabled people organizations of persons with disabilities, other civil society organizations, and even private entities who are willing to support in one way or the other. And then we craft the environment that is not just accommodating, but empowering for students with disabilities. So we recognize this. And one of the success stories that I can talk or I remember about is a collaboration with a civil society organization, which is known for promoting inclusive education and resources. So we kind of allowed that platform for them to help get professional development support through us. So we partnered together to do a professional development program. And in that, we trained some faculty staffs that they had and also equipped them with the knowledge and skills to teach in a diverse classroom. So basically, we did like workshops that period, and the workshops were disability sensitive. We tried to also use assistive technology, and it was focused more on persons with Down syndrome and persons who were visually impaired. And we had it at different times, different cohorts. And with that training, as a result, the educators who were, part of the program who were recruited were better prepared to modify their curriculum and engage all the students, effectively. We also partnered with another resource center in Lagos and in Nigeria, and we partnered with them because we wanted to use some sort of assistive technology to help equip some students with disabilities in terms of, books in Braille, the text-to-speech software, and other large print materials. So with that, it was more like a personalized learning for them. We didn't stop there. We integrated training sections for the trainers, and we're able to use that training to, provide a better accessible feedback for our students with disabilities. I think another case study I will also talk about, has to do with how we were able to collect feedback from the event. So like I said earlier, this feedback was used to understand how to improve our programs. So we got feedback not just from the students with disabilities, but also from the faculty of trainers that we had, see how to improve our programs. And it's really worked, because with that feedback, we're able to use that to generate more solutions that are tailored to their needs. I think I'll end here. Thank you.
No, thank you so much. It was quite insightful. And any examples on your side, Juliet, from a doctor's point of view in success?
Yes, so here in Zambia, like I said, I work as an ophthalmologist, so I mainly work with a lot of visually impaired people. And what our country actually established is a huge Zambia library of cultural skills center for the visually impaired. This center helps to rehabilitate people who are newly visually impaired, to teach them how to survive by themselves, basically. It equips them with different computers and phones which help with their impairment. As well, it gives them a wide range of books. So, for example, if a student is university and they need the book to be translated into Braille, in our university University of Zambia, which is the largest university in Zambia, a special education. Oh, sorry, my internet is
yeah, we lost you in the last couple of sentences not so long ago.
Can you hear me now?
It's breaking a little. Maybe if you turn off your camera, would that help?
Okay, let me try.
Yeah.
Is this better?
I think so, yeah, now it's better. Yeah.
Okay.
So
we have our University of Zambia, where we actually have a Department of Special Education, which actually provides support to people with disabilities, and also equips them, and also teaches lecturers on how to interact with people with disabilities. As always, we have a lot of different NGOs like UNICEF and the Christian Blind Mission, which actually started a social cash transfer to help students with all their school needs as they enter higher education learning. As you know, disabled people have much more needs financially than the normal person. So they come in and they help with the social transfer needs, they help with the cash support in disabilities. Yeah.
Yes. Thank you so much. I mean, just one question for the library you mentioned. Who is funding it?
So this is funded by different partners, NGO partners, and the government of Zambia. Yes.
Okay. Thank you. And I think that a cross-cutting between Rachel's input and your examples are also to train the teacher to be more inclusive in how they do their work. So that I think that's a very good point and an example. And Kenewe, over to you to share a great example of inclusion in higher education, mostly.
Oh yeah, thank you. I think many higher education institutions have like dedicated disability services offices that provide a range of support services and accommodations for students with disabilities. And I'll take you through my personal experience. When I came to the UK, the Disability Service Office played a really key role in making sure that my transition is smooth. They designed a study plan and shared it with my personal academic tutor and other lecturers to make them aware of my disability and accommodations they may need to be aware of or provide based on the information I provided. That was really helpful, and because when I came here, they were ready and willing to help me like transition and get used to the new environment. They also organized a transport for me from the airport on arrival and organized like mobility training for me for the first 2 weeks to orientate me around the campus and the city. That is laudable, and really it was helpful because it somehow made me more independent, not to depend on people all the time. They also like have a personal evacuation plan in case of emergency. That was done by my program leader, who took me through it and assigned people to help me in case of emergencies. That are some of the things that I think that they don't take much, but are really needed. And about half of the time, they are overlooked, but they are really helpful. And I've also realized that even in the classroom setting, they are accessible and lecturers are conscious of the diversity in the room all the time. They always upload material on time for us to go through before the sessions. And if they bring any printed material in class for class activities, they always have mine in accessible formats. So yeah. Those are some of the practical examples that I have experienced when I came to the UK, which is something very different from my secondary school and my undergraduate university, where I had to depend mostly on my friends to access information.
Thank you so much for sharing that, and it's very good to hear that it's working well, hopefully in all schools in the UK as well. But that's an effort that the schools, the higher education institutions need to make. I mean, when you have an international student, you have a pack for them to introduce the city, the university that is available across the board, but having the extra step and making the extra effort to make it accessible and more welcoming for the students, disabled students, that's really what the value that showcase the inclusive values of the institutions. And it's good to hear that you had such an experience. Before moving on to the next question, do you have any other thing to add? I'm asking the panel, any other examples that pop into mind that you would want to share? So I'll move on to the third question we have questions in the Q&A. I'll also tackle those. So please pop them in. Yeah, of course.
I wanted to add something on accessibility. Like I wanted to say, even the transport system in the UK is quite accessible. Like for me as a visually impaired coming to the new city, to the new country altogether, it was my first time experiencing a bus that will alert me that the next stop is this stop, the next stop is this stop. That doesn't really, that is really helpful for totally blind people.
Yes. Yeah, it's not only about the institution itself to change and make the environment more welcoming, but it's also about the infrastructure of the city and how the cities are also inclusive for disabled people, and not only disabled, but for everybody. I mean, how they change and how they implement those access features. Thank you for adding that. And I'll move on to the next question with you again, Kenewa, if it's okay. So what strategies can be employed to foster a sense of belonging? I think you mentioned it a little with your examples, that you felt better and welcomed when they took the onboarding, the inclusive onboarding system was there in Sunderland. But yeah, again, what strategies can be employed to foster a sense of belonging and community for disabled students within higher education institutions? Could you elaborate around how that could create a sense of community? Kenewa. You're on mute.
Oh.
Yes.
Oh, hello.
Okay. Hello, we're here now.
I wasn't aware that I was muted. Okay. So I was saying, like, while I'm happy about the academic side of things and how accessible everything seems to be in the UK, I'm really bothered about the invisibility of students with disabilities or any disability-related activities in campuses. Like, well, I know disability is a cross-cutting issue, and I'm not even advocating for exclusion in an inclusive environment. But I wish there can be more peer support groups or forums where disabled students can connect with each other, share experiences, and offer mutual support. I mean, these groups provide a safe space for students to discuss their challenges and experiences on a daily basis, on and off campuses, and they build friendships within the community, the disabled community. And I think maybe if there can be a special seat allocated for a representative of students with disabilities within the student union committee, that can help address such issues. Like there are many established societies under the student union in my university, like the LGBTIQ plus society, faith, religious groups. And I wish that we can have more or one of for disability, because life at a uni, especially away from home, can really be lonely if you have no one to talk to or to forge friendships with. And I think also the other thing that a university can do in the absence maybe of disability societies, if they feel like they be more like promoting exclusion of some sort, they can help like implement peer mentoring programs where disabled students are paired with more experienced peers to give them or provide them guidance, support, and mentorship, especially the new students, to navigate the challenges of college life, access resources, and connect with the campus community. Yeah, thank you.
Thank you so much. I mean, yeah, you touched upon the peer support group that Rachel also mentioned, that I think has the potential to work great. Yeah, and over to you, Rachel. Do you have any idea of what kind of strategies can be employed to foster a more stronger sense of belonging and community?
Yeah, I mean, I echo her words, because again, I feel that's very important. I've seen that work for us. Apart from that, I would say investing in research, because again, we need to understand the barriers to education for students with disability and really develop tailored and evidence-based solutions to counter those problems. And that will really help to encourage innovation, especially in assistive technology and inclusive resources. I also think that, the individualized educational programs, which some schools do not believe in, especially mainstream schools, I think it should be considered in this picture, because again, students' unique needs and learning styles are varied, they're different. So we need to encourage students' participation in that sense of learning, because it will help to boost their decision-making process, and it will help them in terms of, relation to improving their educational enhancement, and then, the support that comes with it. I also think that we need to also have, like I said, that continuous monitoring and evaluation, because without us monitoring to understand, the effectiveness of all of these practices that we're executing, the sense of community among students and with disabilities would not be that much. So we need that, because with feedbacks from students, from special educators, from caregivers, we can refine and improve our strategies. So I'll end here. Thank you.
Can I ask you to elaborate around the individualized learning program? So what do you mean by that? I mean, I have a fair idea around that, but how would it be? So would it be a special program for disabled students to attend to, or more tailored content?
So when I think about individualized educational programs, or it's just basically some sort of platform where students and the teachers themselves, like every student has their different learning needs. So instead of you having to teach students with a one-size-fits-all approach, you're teaching students based on their specific needs, on their specific areas. So for children or learners who cannot learn with reading or writing, there's another mode for them to learn. And that's basically what individualized educational program means. So you're learning in a way that it's uniquely tailored to your needs, uniquely tailored to your productivity as a student and your capacity as a student as well. So that's basically what it means. And it's worked over time, because with that, you also have individualized assessments where you begin to observe and understand, those areas of progression with students. So I'll give you an example. In a rural community in my country, we work with some of the local teachers to use everyday materials and observations to assess the student abilities. So one child was nonverbal, and he has autism spectrum disorder. And through the careful observation, this teacher used local storytelling to engage him and reveal his exceptional memory and attention to detail, which, is traditional tests would never have uncovered. So this way, assessments like this, individualized assessments which is part of the individualized educational program, becomes very useful because it's deeply rooted in, maybe a community's cultural way or community's or the child's way of learning. So that way you're able to maintain quality feedback between the student and the teacher. Yeah.
Thank you so much for elaborating on that. Yeah, thank you. Shall I move on to Juliette now to hear our idea about good strategies that would foster a sense of belonging and community?
I think Rachel and Kinoe have said a lot, but just to add, I think it's also important to provide adequate counseling and mental health services. As you know, higher education can be quite stressful, but for people with disabilities, they come across more challenges, and it's really important to have that mental support, that mental well-being for them in a safe way. And what I found in our situation in Zambia is we tend to isolate disabled people away from the main community, which I think is a wrong approach towards things. We'll make things isolated, like that school is for the deaf, that school is for the blind, that school is for that. And I think that's a very, very wrong approach to things, because what it is that children at a young age should be aware that there are people who are differently abled in this world. So rather than separating everyone, it's better to have them all learn how to interact with people who are differently disabled from you. And also teachers can also learn, rather than just saying we only have the special teachers for this group, let everyone be able to teach everyone. I think it would be much more better. So a lot of people in my country specifically don't know the laws and the policies that are available to them. So when somebody enters higher education, I think it's important to also teach them, like, this is what's available to you. These are your rights. These are there to protect an advantage over somebody who is differently abled. And a lot of people won't come and tell you, actually, this is for you, they might just leave you to be like that. So I think it's very much important to also equip disabled people with the knowledge of what laws and policies are available for them. Yeah.
Thank you. Yeah, I have a couple of follow-up questions, but I also want to just read out quickly the questions in Q&A, and maybe just give me a second so that I understand if we're aligned with it. So we have a question from Colin O'Gara from Uganda Alumni Association. And his question is around how can we best adopt the suggestion around inclusion in education across the Commonwealth, and how we can measure global success across the Commonwealth. I think that global success, we tackled it not in terms of measurements of key performance indicator, but we all talked about feedback, the continuous feedback mechanism. So that means that we also have a success and continuity and sustainability strategy around that. But we also talked about empowering students through peer support group, to now that Juliette. Can you hear me? No. Can you?
Yes, we can hear
yeah,
you.
you're here. Okay. Sorry, my headphones just went off. We mentioned this, yeah, through peer support group, through mental health services, and also through guidance. From my input around global success would be also around telling our stories and telling what happened before, so that we could learn. I mean, it could be it could be a failure, it could be a success, but institutions also frequently fail to mention how they came up to that point. So I guess that even the Sunderland University, it wasn't an overnight decision to make this onboarding strategy with disabled students. They didn't, I think, I mean, I assume, but maybe they did. but that wasn't like the first time didn't work properly. But we failed in disability inclusion mostly. We failed to share our stories where we failed, where we learned the most actually across the board. So for me, success would look like sharing our stories, sharing our guidelines, and sharing what happened before we are today now. But for you, what would global success look like? I can start with Kenewe again, or anybody wants to jump in. And Kenewe, if you're answering, you're on mute, so we can't hear you. Maybe, yeah.
Hello.
Hello again.
Okay, can anyone pick that question, please?
Yeah, what would global success look like around disability inclusion now across the Commonwealth? What would be the success for you? How can you define it? It's a big question, and success is a limitless answer. So what would you define as successful in the realm of Commonwealth and in UK institutions being inclusive? What would be the success story there?
I think for me that the global success will look like having more people with disabilities acquiring quality education, and having like governments being very intentional about inclusive education. Because many countries, especially developing countries, we have like good policies that speaks to quality education, inclusive education, but half the time you find that our inclusive education is exclusive. What do I mean by that? We have like a number of students attending school, but do they acquire quality education? Do they get do they access education on the equal basis with other non-disabled learners? The answer is no, because you find that they don't even have like access to information. They don't have assistive devices. Teachers are not well trained to interact with learners with special educational needs in a classroom setting. So for me, global success with having like learners with disabilities making it to tertiary level. Like if you look at the numbers, they get deteriorating on both, like from primary education, secondary education, undergrad, and like postgrad. I can literally count the number of people I know from Lesotho who are visually impaired who made it to tertiary education. So, yeah,
Thank you. Thank you so much. Rachel, do you want to jump in and share your idea of global success?
I think global success is relative, but I think also that we need to start thinking about establishing like twinning programs between countries and institutions, and that means with inclusive educational systems and those seeking to develop theirs. So perhaps these partnerships can include student and staff exchanges, joint training sections. There could be sections for shared curriculum development projects. Another thing is maybe deploying teams of experts from countries with advanced inclusive educational practice to provide maybe technical assistance to, developing policies like countries that, have these issues, and also help them with their teaching training programs if possible, like guide, I wouldn't say help, but guide them because they need to be self-reliant.
Yeah.
I would also say we need to develop an online platform where resources and training materials like policy documents and success stories are shared among Commonwealth countries. And it will be very useful because that way we can use this as an open source to really facilitate virtual support and collaboration. And we could also move beyond the policy and intervention and really promote a culture of, inclusion within schools and, the communities themselves, and raise the awareness for cultural diversity. So I'll end here. Thank you.
Oh, thank you. I think it's a very good point. Yeah, Juliet, do you have anything to add?
I think you guys have added a lot. I think it's important. Data is very important because you find a lot of our countries lack the data to support what it is we're pushing for. So without that data to show, we lack this in these schools, we lack that in these schools, we can't really take any step forward. We can't push policy without having that data to support that policy needs to change. I think that's very important. We need to do more research. We need to find out a bit more of what our needs are. And it has to be contextual. Some of us live in a country where we have a lot of load shedding, even in universities, there's load shedding. So we can't always adopt what is out there and put it in our countries. We need to come up with something that can work in our settings, and also in our cultural practices. As much as the world is a global village, we're also specific tribes in that village.
Yeah.
So we have to come up with things that are contextual to us. And it's hard to compare ourselves to say we are successful in this rate when we're all at different levels in different countries, I think it's very hard to quantify that. Yeah. But more contextually, are we being successful in our own context? I think that's a better way to measure our success.
That's a great input. Yeah, and I think, yeah, definitely. But the themes that are recurring are also, invest in the research and invest in tailoring and understanding what's happening on the local ground, but also on the global ground. And all stories are quite unique in a sense. It would be very wrong strategy to try to fit everything into one box. That's what I hear from you, at least. And we have another question from the ground, and I most probably would mispronounce the name, but I just want to read it out anyway. Oluwasegun John Jegede. In most low-income Commonwealth nations, in what ways do you think assistance can be made to these countries to adopt policies that will provide more accessibilities to disabled people in their higher education institutions? We tackled this issue a little, but it's also about adopting policies. I mean, yeah, we mentioned that policies are there most of the time, but that in practicality they're not delivered, or they're not used, or they're not shared or made known. So I think one of the actions here would to make those policies known by their stakeholders. So disabled people should know about the policies regarding them. And there should be mechanisms within schools to guide them through what's available for them as well. But does anybody have any other comments around this?
All right, I can just give it a short.
Yeah.
So I think we should also be cognizant of the local policy development across countries. So when we're thinking about this, we're thinking about the guidelines for how international organizations and donor countries receive technical assistance, to draft, enact, implement, the disability laws. So again, we can think about that and also create awareness about the importance of accessibility and inclusion in this context, and encourage the governments to act and hold them accountable, as well. Because again, if you don't encourage them to act swiftly and see the importance of this, then they would sit back and do nothing. So we need to push them or instigate them to act, and also share success stories from other regions, as data and catalysts to spur them to do this. I also think that apart from financial assistance, which is always needed, in terms of, interest loans and, making, some sort of support in terms of grants, we should also be thinking about the capacity building. Because again, we need that capacity building for, local architects, urban planners, to be able to imbibe on the universal design principles that can ensure that new constructions and renovations of existing structure are accessible in terms of the standards for persons with disabilities. The same thing goes with the HEIs. They need capacity building to understand and implement accessibility measures when they're doing workshops, webinars, forums, exchanges with institutions from other Commonwealth countries. They need to begin to think in that light of, that capacity building training that goes beyond the superficial level, but in-depthly that, helps to, helps them to refine their capacity based on what they want, So yeah, that's where I'll end it, but I'm sure all of this should help. Yeah.
Kenue or Juliet, do you have anything to add around what ways do you think assistance can be made to the Commonwealth nations to adopt policies? Juliet
Hello?
says no. Kenue, yes, we hear you.
Oh yeah, I think like I said before, I think like most Commonwealth countries like most beautiful policies when it comes to inclusive education. The problem becomes implementation, which half the time people cry that they don't have enough funds, disability is expensive and all the stuff. And the disability activist in me right now feels like because most of developing countries depend on aid to carry out huge projects like building schools and all that. Maybe this should come as that we should like encourage universal design principles that encourage consideration of needs of diverse range of users to create environment that are inherently accessible. And maybe this, if this can come as part of the terms and conditions to accessing such funds, maybe this can really help.
Thank you. Thanks so much. So we are almost at time. I have one last question which would, I think, sum up all of our discussion. But I think that you had very good points around what to do more practically. But I would want to hear from your priority. One priority that your first priority, not one priority, but your first priority. What would be your first priority to take forward to make education institutions, higher education institutions, more inclusive of disabled students? Can I start with Juliet, maybe?
I think it's awareness would be my first priority. People are not really aware of the spectrum of disabilities. And like, I think Colin had put in one of the questions, like we have visible and invisible disabilities, and how do we best support? And I'd also want an answer to that, I'm someone who has hearing disability. I don't hear that well. And, sometimes you find yourself in situations where you're not able to get the information you need, but no one can really tell from looking at me that I don't hear as well as other people. So I think awareness, I would love a situation whereby you can make people aware of certain invisible disabilities, and people should also be like, I feel like awareness is just the key. Like people should be aware that there are certain people with certain kinds of disabilities, and this is how we should interact with them. Like I said, most of the time in our country, we ship them away. Like you isolate them into one corner of the country and, try to forget about it. Even culturally, that's how we approach people with disabilities. And I think it's very important to start at the cultural level, at the community level, start with your leaderships there, start to making them aware. Like, when you have somebody who's born different, it's not the answer just to throw them away and say they're not able to contribute to the community anymore, but there's so many ways we can help them. There's so many avenues that are available to them. So I, as well as Colin, want to know, how do we draw the line of inclusion between invisible and visible disabilities? It's actually a very important question. So awareness, yeah.
Yeah, I think that by the way, just I messed up the timing. We have still 1 hour, so I was just conscious of time, but too conscious. So we have time to discuss around. That's why I skipped Colin's question actually around visible and invisible disabilities. But the point that you made around creating awareness that what's available and what's there. What are the audience that we have? I think one of the things that we're missing most, not only in higher education institutions, but in all institutions and in our daily personal encounters with people, we don't know our audience, or we don't know the possibility of the audience is bringing in. And when we talk about the disabled community, we talk about 12, 13, 15% of the population globally. So if we're not aware of this population, that means that we're missing on a 15% of millions and billions of people that we're missing out and we don't know of and we don't engage or interact with. And that means that we're losing them in the workforce. That means that we're losing them in the education, in the life, in the cultural life. So that's maybe that could be the next stage of our discussion on how to create this awareness. I'm not sure if I dodged the bullet in terms of the next hour, but I think that it's a good segue to it. So again, you want to add something there, Juliet, or should I move on with our other panelists?
You can move on. I mean, short of wearing a badge on your forehead,
Yeah.
like I'm disabled, like I'd really like to hear the input from my other two colleagues on that.
Yeah. Yeah, I mean, of course, when I'm in the 15%, we would want people to come forward and define themselves or shout through the roof that, okay, I'm disabled, I can't hear you or so. But if we make the work that we do as inclusive as possible, we automatically include those people. I mean, that's not on them to make the effort, but rather it's not on the disabled people to make the effort, but rather the institutions and the structural changes should make the effort to include everybody into the system and without excluding anybody. So moving on maybe to Rachel, again, we can base your answer around your top priority, or you could follow up on awareness if you want a little more.
Yeah, I'm building up from Juliet's because I feel it's really important. And when we think about the policy, already we're so blessed with the Convention on Rights of Persons with Disabilities, but how many countries are actually aligning that rights to their national policies, national disability policies? Every country has their national disability policies. In the US, they have the American Disability Act, which I know America has not ratified, but again, the UK is a very good signatory to the CRPD. But my question is, if we begin to think around the CRPD and use some of this, the enshrinement of this protocol to push in our national narratives, trust me, I believe that inclusive education will be good. And how do we do this? Awareness. We need to find a way to create awareness whereby most of this policies about disability rights and inclusion are made accessible to people with disabilities themselves. They don't even know their rights. So how do we do this? We can start this from schools, from the elementary school down to, tertiary institutions, because that way it's grounded and deep-seated in them to understand their fundamental human rights and fight for it. So it's really very important that we have that engraved in our culture and every fabric and essence of our schools, institutions, and various, organizations. And again, I would also talk about UDL. I think someone talked about it briefly, but UDL is also an educational approach that would help to offer flexibility in ways that students assess material and engage with it. So we need to ensure that UDL principles, have a way that equitable accessibility to learning becomes a priority for students with disability. So I'll end here. Thank you.
Thank you. Kinewe, do you want to add anything around that? Around awareness and how we can increase it?
I wouldn't want to add anything on awareness. I think they covered a lot of things, but I really want to talk about my priority.
Yes, please do.
I would prioritize research. I know Rachel touched on this earlier, and I really think it is one thing that is really important. Countries need to invest in research and development for initiatives that focus on technologies, innovative solutions for specific needs of students with disabilities. in higher education, not just in higher education. In fact, we need to start from primary education, because it won't really help for us to have like accessible higher learning institutions, yet we don't have learners with disabilities who graduate into getting into those institutions. We need to have our education and curriculum adapted to ensure that learners with disabilities from a very young age are really groomed in a way that responds to their needs and get quality education from a very young age. I'll also talk about, still on that, investing in research.
Yes.
As someone who experienced limited access to information in the past, from primary to undergrad, I'm really obsessed with equal access to information and assistive technologies, because I know how frustrating it can be to have like outdated equipment or softwares, or not have any of them at all. So really investing and having disability-specific budget to respond to these challenges would really be my priority.
Thank you. We have new questions from May. Okay, we have a question from Yunus, who asked directed to Rachel, actually. Can you share any experience as regards budgeting for inclusive education for disabled? This is often overlooked in Nigeria, and I don't think that's only overlooked in Nigeria, unfortunately, but in many contexts it's overlooked, because our approach is more around, you either do a Braille translation or you do a voiceover of a text, and that's okay, and you have a very limited budget, or you have a sign language interpreter to the video, and that would make it inclusive. But it's more about planning inclusively, which requires a huge share of budget to be as inclusive as possible. So any comments on that, Rachel?
Oh, let me just read the question briefly.
Yeah,
So
of course.
could you repeat it again? Any experience as regards budgeting for inclusive education? I would say budgeting is very dynamic, because again, when it comes to budgeting for inclusive education, you have different disability clusters. Like I said, we've dealt with our nonprofit deals with only 4 disability clusters, but we accommodate others, but our priority is 4. We deal with persons with Down syndrome, autism spectrum disorder, cerebral palsy, and those with visual impairment. Why? Because that's our capacity. That's where we can reach, okay? But when it comes to budgeting, it's very important to think about participatory budgeting. And we do that because with that, we're able to work with partners. We don't work alone, we work with other CSOs and disability people organizations, as well as other institutions. So when we work with them, we align their priorities with ours. And with that, we're able to create a participatory budgeting where we use different I don't want to go into the technology aspect, but with that budgeting and templates, we're able to understand, how we could put or align different disability clusters and programs and various, events into that sheet. Then when it comes to the real work itself, we ask parents, we ask educators, we ask even the persons with disabilities what they need for the program before we even go on to tailor our various lines of item, because we want to understand where our money is going to and what impact it's going to give to those people that we're trying to create the programs for. So with this needs assessment, we use that data to create a comprehensive budget between our partner organization and us. And then we also have feedback budgets, because with that, it's also expensive to get people together again virtually, and as well as, I won't say virtually, physically, like together to be able to discuss. You need to also think about that. The discussion is not just with parents and educators, but also people with disabilities. We have self-advocates who come, they are like ambassadors. They discuss their own needs as well and where they need the improvement. So it's also expensive. We also put that into our, budget. So again, all of these are all part of the participatory budgeting system, where we get all the stakeholders together and puts all, the various line items of needs and use that costing to understand where our money should go. And we also try as much as possible to use this, all of this as a reporting system to, organizations that support us financially, because again, you have to report to those organizations where you've received grant support or technical assistance from, so they understand where your impact is reaching. So yeah, I hope it answers your question. Thank you.
Thank you. I have a follow-up on that. How do you share your practice externally, or do you have, you have a feedback mechanism, you feed into it, you decide together, you design inclusively, basically, from budget to the activities that you're doing. Do you have a mechanism to also sharing your stories and learning with the public?
We use the social media to discuss our stories a lot. We go on various media channels. We use LinkedIn, Facebook, Twitter, and Instagram. And then these are just analogies and testimonials from not just people with disabilities, but also parents and special needs educators. We also, when we do our end of year report, there's a comprehensive package of the things we've done for the 4 quarters or 3 quarters of the year. So that way people who are part of our community are able to see and understand, what we've done. So that's basically another way of feedback, because again, when they see that, they're able to comment and share their own experiences as well and share areas of recommendations. So all of these are part of the things that we do.
Yeah, thank you.
You're welcome.
Juliette or Kenewe, do you have any examples or good practice or bad practice to add around budgeting and inclusive education or inclusive practices that you would want to share that you experienced?
I don't have a specific story on budgeting, but one thing I found helpful when I try to advocate for certain things is to put my audience in the shoes of somebody who is actually disabled. For example, we'll have like blind dinners where we blindfold our participants and give them just a bit of a taste of just a small percentage of what patients or people with disabilities go through, especially the visually impaired one. And when you give them that real, experience, you find people are more willing to help with your policies than when you just give them a very technical presentation. My favorite strategy is always to start with the why. Why do we want what we want? Why are we trying to achieve what we want, rather than the how are we going to achieve it? So if you can connect with people on a more emotional sense, give them stories on this is what this person specifically is going through every day, I think it's more helpful. What I found helpful as well in my school, at the London school, we used to have guest lecturers who were visually impaired giving us lectures. And I thought that was amazing. I was like, wow, I didn't think, I've been in Zambia, I've never seen something like that. And I think that it can be very inspiring to other disabled people. If they could have people who they can look up to, who are in such big positions, they went through university, like it's possible, guys, these things can happen. If we could have more people who are disabled, who are actually making it in the world, come to talk to other people, I think that can be very, very inspiring and get the ball rolling, I love a good example. I love a good real example on how to successfully get through things rather than technical. So, yeah.
Yeah, basically representation really matters when you see disabled people in positions of power, but in brackets and the power, or in places that you would want personally to go. That's possible. That's definitely a very good example of doing things. But again, this is a chicken and egg thing. You have to have inclusive education to be able to have disabled speakers or disabled academics. So they need to go through this inclusive education system to be able to be there, or they need to struggle and to make their way into it. But yeah, the higher education institutions have a lot of to do there. And Rachel, you have your hand up.
Thank you. I actually noticed, I was just reading through the Q&A. I realized that a question was not, treated, but I don't know if you were going to come to that. I think the person asked, like, we have visible and invisible disability. How best do we support inclusion in this category? So,
Yeah.
is this something you'd like to treat later, or do you want me to
Yes,
talk
yes.
about?
I mean, we talked about it a little in
Okay.
Juliet's answer, but yeah, please do. Maybe I go to Kenoe around the budget question, and then we come back and we talk about the visible and invisible disability. Kenoe, do you have any input around budget and how to? Yeah, please do.
I'll agree with my colleagues. I think the issue of representation is very important. Like when I look back with organizations that I've worked with and the kind of initiatives that they carried out, I would really say that it is more easier to influence the system than when you're trying to advocate from the outside. I'm talking about organizations like the Vodacom, like the project that they make, like the visually impaired library in Lesotho and everything else. But when you try to advocate from the outside, it's quite challenging. I don't know why, but I also want to believe that the disability budgeting is not just ignored in Nigeria, but in many countries. And I think this is because people are not really intentional about disability inclusion. Half the time it is done on tokenism basis.
Yeah.
For most countries or institutions, it's just about ticking boxes or a matter of compliance, like saying we have 1 or 2 people with disabilities, we have 1 or 2 students with disabilities, not really being intentional of the quality of services they get or the quality of contribution they make. So yeah, that's what I wanted to say.
No, that's definitely that. I mean, yeah, it's the intentional versus the ticking box exercise that I think we face in every context, in every country. As much as the country is inclusive in their policies, we don't see always it reflected into the way of doing things. It's more of a compliance thing, as you mentioned. And I think those discussions that we are having now and your involvement and the activism of disabled people, mostly coming from them, would break this approach, has the potential to break this approach. But we need to have more of those discussions and on each and every level. So it could be within this context that we are today, but it should be also part of the rectors or the dean's agenda. It should also be part of the high school teachers' agenda and in the medical system as well. So we have to mainstream disability inclusion across the board to make it, to break this process of a ticking box exercise. And yeah, so I'll go back to the questions in the chat. For the first one, I think we tackled it. The second one as well. Yeah, we have again a question from Colin, and he says that we have visible and invisible disability. How best do we support inclusivity for these categories? We briefly tackled this, but if you have anything, I think Rachel, you would want to have an input on that. Should I start with you?
Okay, thank you. So I think that when we think about visible disabilities, we're looking at the physical, like things that are really very, glaring, the things you can see. So we know them. But again, we need to also think about how we can provide personalized support for them. So when we think about this, so are we thinking about sign language interpreters when we have events, even, virtual events? There should be a sign language interpreter. That is very important. Note taking. So again, aids that can help to tailor their support irrespective of their needs. And then providing training to staff and educators on how to use assistive technology that support learning and working for them. We also need to think about inclusive design. So we need to ensure that, for example, God forbid, if there is some sort of emergency that people need to run away or evacuate, there needs to be, every structure needs to have an emergency evacuation plan and safety procedures that are accessible for individuals with visible disabilities. I remember, I think COP21, there was one of a representative who came for a program, one of the program within the few days, and he or she was on wheelchair. And I think I read it years ago. She couldn't access the hall because of the fact that, it was not accessible for her to go on that staircase. There was no ramp. So again, thinking of all of this inclusive designing in public spaces, it's really very important so that we can have truly inclusive platforms for people with disabilities to thrive. As for invisible disabilities, I think we need to create more awareness, even if it's now local languages and dialects, because again, there's a cultural contest around disability, especially in African countries. Some people believe that maybe, I won't talk about the countries in Africa, but some countries in Africa see albinism as a cultural issue, religious issue, I don't know, a traditional issue. And, many of them have gone through endangered lives, because as a result of that. So understanding, those invisible, because again, some people still argue if albinism is visible or invisible. But again, think about it, it's a skin pigmentation, it's a condition. So when we think about this, how do we help reduce the stigma and promote a culture of inclusion in that regard? Again, thinking about encouraging open dialogue like this, because with these conversations that is recorded and shared, somewhere for people to watch after, even those who could not attend, it allows people to understand some of the nuances and share, their thoughts about, oh, this is not right, this is right. And they understand, areas where, needs to be met. And then we need to have policies that are truly inclusive. Because again, if it's inclusive, this includes that non-discriminatory practices like, educational discrimination, employment discrimination, all of them would be, reduced. And we also need to ensure that disability support are easily accessible, for people with disabilities. I think I'll end here. Thank you.
Oh, thank you for this input. I mean, I think that inclusive design hasn't had the luxury to be tokenistic. It needs to be thorough, and sometimes, and we need to be transparent as an institution on what we could deliver, which area we're delivering. But first, we need to understand and be aware of the situation, of the scope of disability, of our audience needs, etc. And then, in some cases, sometimes we might fail to deliver. But again, if we're aware of the situation and we are transparent as possible. For example, in some cases, you can build a ramp in an already available place. But if they were to mention it in the visitor info or the website of the event, this person wouldn't have come, but they would know at least that it was taken care of, that they thought of that, but they couldn't deliver. And in some cases, unfortunately, the infrastructure of the cities that we live in, the building that we work with, is not as inclusive or accessible as we want them to be. But I think that transparency is quite important, I wouldn't say a priority, but one of the values that we need to have to be as transparent as possible. For example, you said, Rachel, that you are only working with Down syndrome, cerebral palsy, visual impairment, and autism because that's your capacity as a team, that you could only do that. That's a statement that we would want to see from all of the institutions around, not only in higher education, but around the globe, to understand what their capacity are. But for that, they need to be aware of the needs, then understand the capacity, and then transparently say what they could or could not deliver for everyone across the board. So, yeah. Anyone wants to add, Juliet or Kenewe, around visible and invisible disability and how best to support inclusivity for these categories? Do you want to share anything?
Yes, please.
Yeah, Kenewe.
Yeah, I think the first thing is to believe when somebody tells them or disclose their disability, because it's not visible. Some people tend not to believe if you tell them that you have this kind of disability. And if you don't believe them, it's going to be very challenging for you to be able to help accordingly.
Yeah.
Like for people with psychosocial disabilities, because they are not visible, people like don't really, at first glance, recognize their disability until they disclose to you. If they disclose that they have this kind of disability, then they can spark that kind of conversation on how best can we help. Either in school or workplaces or social gatherings. Maybe this can include like flexible working arrangements if it's in a work environment, or extra time for tasks or assistive technologies that may help them like cope in such environments. Yeah, that's just what I want. Well, I'm not an expert to that, but that's just what I'm thinking.
No, that's definitely
Because
that.
sometimes even for this goes even beyond like people with disability. I mean, this also goes for people with disabilities, even for the disabled community. In some countries or in some instances, like Rachel made a reference to people with albinism, some people still think that they are not disabled enough, therefore they don't deserve this kind of treatment or disability treatment or disability allowance, maybe I may put it that way. So the first instance is to believe that someone has disability and need assistance or extra assistance.
Yeah. I mean, flexibility is also, I think, linked to the transparency and to awareness. I mean, to be as flexible as possible and understand that flexibility is also a must for disability inclusion. Institutions need to be more flexible in how they operate, and that includes higher education institutions as well. So yeah, thank you for your input. And when you mention believe, you would assume that when somebody discloses something that you would believe them by default, but yeah, there is a reluctance mostly around disability because we have our assumption and our biases. I mean, when you talk with Juliet, and I'm sorry to put you on the spot here, but you won't think that they don't hear that well, or you won't. So when the person discloses, usually, as I said, they say, really? I didn't notice. The wording is always around, a doubt or a trust issues. I mean, and that creates a huge trust issue between the disabled person and the people that they're talking to, and that's very hard to build on trust after losing it. So that we should be very. I mean, that's why I think that transparency and openness and flexibility are really at the core of disability inclusion. Thank you for sharing. So we have a comment from Colin rather than a question and how they work with. So I will read it out, and I'm not sure if they're still on the line, and I'm not sure if we can hear them talk about it, but I'll just read it through. So I work with Asante Africa Foundation, and we support digital learning in rural schools to address inclusion needs, including disabled children, and happy to share and see if we can do advocacy to scale this across the Commonwealth countries. This is in line with our theme of the year, implementing inclusive programs across countries and undertaking randomized control trials. So I'm not sure if technically it's possible. So if any technical support team could get into it. Otherwise, Colin Ogara, he, as I said, he works with the South Africa Foundation, and is also an alumni, the Uganda Alumni Association link. So if we can have them on the call today, maybe we could follow up the conversation via email. I'll drop my email into the chat box, but not sure if everybody could see it, right? Yeah, and we could continue the conversation afterwards. I have one question that I think we more or less covered, but I want to ask it, and maybe if we missed anything, or if you feel like you missed anything, our panelists, you can have an add-on. So how can inclusive practices be integrated into the curriculum to ensure that all students have equitable access to learning opportunities? So we mentioned flexibility, we mentioned individuals learning program, we mentioned inclusive onboarding scheme, but do you think that we missed anything, or do you want to add anything? Juliet, you put your camera on. Do you have an input there?
I think what learned at London School is when I was making presentations for my classmates, even though none of them had any disabilities, would still make the presentations accessible to everyone. And I think that's a skill which people need to have, not only putting the burden on the teachers to make sure the material is inclusive, but also the other students need to learn how to make that material accessible to their classmates and stuff like that. I think that can be very helpful. So you can take that skill with it wherever you go. Like if you can learn it while you're in a higher learning institute, you can take that skill wherever you go. When you start working, you have that in the back of your head, like, wow, I'm making this PowerPoint presentation. Have I made it accessible to everyone? Have I put closed captions? Have I put like an audio track? I thought that was a very, I never knew about that before I went to the London School of Hygiene. I didn't know that you could make PowerPoint presentation accessible to everyone. So I think that's actually quite an important skill for people to learn.
Yeah.
You don't have to wait until you're around disabled people to learn these skills, basically.
Yes. Yeah. Thank you, Juliet. Rachel, do you have?
Yeah, I think another crucial aspect, I think I've mentioned that before, but I think would be personalized support system. So I'm saying this because of the fact that we've had this experience. So there was this young, bright man who had mobility issues, aside from being a person with Down syndrome. So we collaborated with another disability people organization to facilitate, some sort of support. Sorry, who's speaking? Someone there.
We can hear you.
Okay.
We can't see you. No, sorry, we can hear you and we see you. No worries.
Okay, perfect. So we facilitated this access to his tailored equipment and the learning materials that he was able to use. All of this helped him to navigate the physical and academic environment without any hindrance. So he's now not only pursuing his degree in computer science, but is also a peer mentor for other students with disability. So I think it's really important to highlight that inclusion truly goes beyond classroom. So we must champion initiatives such as, disability-friendly infrastructure, social inclusive programs that foster a campus culture where, diversity is celebrated and empathy is ingrained. So again, you also need to understand the power of data. I know most of us have touched that, and how we could use monitoring and evaluation systems that is co-developed with, agencies, international agencies, local agencies, to provide us with insights that will continually refine our practice. Without this, we're just going to keep on running through circles. And this approach will really ensure that our strategies are effective and responsive to the needs of our students and learners with disabilities. Thank you.
Thank you, Rachel. Kenewe, do you have any inclusive practice you would want to share? You mentioned a couple during our talk, but
yeah, I think for me, just the basics, like training teachers how to interact with learners with disabilities in a classroom setting. That is quite important. There's nothing that frustrates me like being in a classroom setting and then you have like a teacher who keeps saying, like, for example, in a math class, this plus this equals 12, and you don't know what this plus this is. So be like, considering those small things that may try to exclude a learner in a learning environment, be cautious of those small things, like getting material like accessible in advance, like making them that they understand and cope well in a classroom setting. Those small things for me, like, yeah.
Okay, thank you.
I think also another thing, especially for the visual impaired learners, because here I'll talk through my experiences. There were instances where we'll be like, you are given it like a question paper, and then the question say, look at the diagram below and answer the following questions. At that time, you are totally blind. You don't know how the diagram looks like. So it's really frustrating. So those kind of small things that need like a teacher to be like, you're well aware of the diversity in a classroom setting, Yeah.
Yeah, thank you, Kenewe. And we have one question around, is there any guidance or link you can share on how to make disability accessible presentations? I didn't know there was such a thing. There are many free of charge and paid content online. When you say training this accessible presentation, I did one, for example, in LinkedIn Learning. I'm not sure if you have access to it, but it's a very 6-hour long, very thorough and basic training that you could reach. There are many institutes in the UK and in the United States that deliver training, more tailored training for participants around that, but there are also free trainings and free resources online. So I think a Google search would help you find an adequate resource for you. And it's something that I also use a lot, and I try to implement a lot in my own presentation, because when you start designing inclusively and inclusive design, that's something that came up in our conversation today as well, you really make it not only accessible for disabled people, but also for the whole audience, because it's clearer, it's more straightforward, it's cleaner in a way as well, because you lose all the details that actually don't really add value to your presentation, but you really start presenting in a more thorough and succinct way. So yeah, I'll advise you to go through the trainings. I'm not sure if we have any other questions on the ground. No, but I was inspired by Juliet's comment on how, I mean, again, how she learned about accessible presentation in their curriculum. Is there one takeaway around disability inclusion that you took away basically from your studies in the UK that you would want to share? I know, Kenway, that you're still studying, but I think you also mentioned the inclusive onboarding, that how good it was, but do you have any other examples that you would want to share? And I think it could be also linked to our last words for this session, and we could wrap up after it. So who would want to start?
Hello.
Yes, Kenway.
Yeah, I think for me it's what I experienced at the Connect and Collaborate event in London recently, when the presentation, like I found the room was really like inclusive for all kinds of disabilities in the room. While the speaker was busy like doing the presentation, and there were, I don't know what that is called, but I think it was for those with speech and hearing impairment. There was a large board displaying everything that the speaker was saying, just like, yeah, in front of them. So yeah, I think that's something that needs to be like taken into consideration when making presentation, especially in a room that is full of different kinds of disabilities.
Thank you. Rachel and Juliet, any experience, UK higher institution related experience you want to share, or any other comments that you feel you skipped during the panel that you would want to share with the group?
Yeah, I think I'm really inspired by the steps which the UK actually takes to be inclusive. I like the fact that you can tune your hearing aid in different places in the UK. I think that's quite helpful as well. And the fact that they do offer a lot of free hearing screening, free eye screening, which is quite important, because a lot of times people are not aware that they are disabled. For me, I just thought like I couldn't hear people well, and there's a pop-up which said, do you want to test your hearing? When I was in the UK, and I went over to, I think, Boots Pharmacy. And that's when they actually showed me, like, actually your hearing is quite reduced in this ear. So I love the fact that they reach out to find people, and they've actually included a lot of things in their environment that helps people. I love the fact that in the pharmacies, there's Braille on the different boxes of medicine, which is quite unique. Yeah, I think that's actually quite helpful. And I think these small things may seem insignificant to others, but it's actually quite significant to people who are disabled. So I would love to take those small minor changes in my community and try to apply them, taking awareness that not everyone has a visible disability, but doesn't mean that we should exclude them just because we can't see it. You know, and that's something which I really want to advocate for in my community. Like, we don't have to wait to see the disability before we make it inclusive.
Yeah.
I would love if we could have our presentations, because I do lecture med students like with captions as well. You know, sometimes I pretend I understand what people are saying, but sometimes I don't really hear it. So I really want to take into the small things which I can make just to make somebody's day a little bit easier, you know. That's probably what I have to say.
Thank you, Juliette. Before going to Rachel, we have a comment in the Q&A by Constance Niamikola. They are the CEO Toro Youth Initiative for Professional Development. They have an input to our discussion that I think we also covered a lot. My contribution is about empowering teachers in this specific discussion. I think more funds and support needs to be channeled to organizations that are working with teachers directly to ensure they include these trainings in their support to teachers. Thanks. That's also something that we tackled around. It's not only about empowering disabled people, but it's also about empowering people that are in contact with them. And in our situation here, our teachers and lecturers to make their content and their training methodologies as inclusive as possible. So thank you for this input. And over to you, Rachel. Do you have any comments there? Yeah.
You mean on the presentations? Because I know someone
on the any take on from the your UK higher institution experience that you find that was a good practice, or yeah.
Oh, for me, I think it's been quite good. I mean, I've seen the UK, I've seen the US. There are really very best or significant practices that we can adapt from them. And I just cannot mention them. I mean, some of my colleagues have spoken about them already. So I think just to help with, you know, what we're talking about today, in terms of presentation and making things accessible, I also think that Microsoft Teams and PowerPoint really helps offer very good, you know, accessible features to enhance accessibility for presentations. I say this because I've been using this for years and it's really helped, you know, not just in my nonprofit, but also in my educational experience in the UK as well as in the US. So, but I'll just give like general guidelines that we need to really use simple languages. So when we're doing that, it's really good because some people have cognitive disability. So we need to have cognizance that simple languages, not jargons, will really help them. We also need to provide like what we're doing now. We have captions, we have transcripts. So that really will help people who are deaf or people who need, you know, as additional, you know, support with to understand what is being said. And then when we talk about slides, some people really use very funny colors when they do slides. So we need to also be very cognizant about the high contrast between backgrounds and the test for readability for people with visual impairment. We need to also avoid color, you know, alone to convey information, and use test labels in addition to like color coding, because it really helps people who are color blinded. And then when we think about visuals like, you know, charts and all of those things, we need to make sure that they're verbally described when we're using the charts of visuals during our presentations for those who cannot see, you know. Even in this kind of program, we're supposed to talk about ourselves. So for example, introducing ourselves, I'm wearing a colored purple shirt, you know, my hair is black, so that people, they can understand what the person's identity, physical identity looks like. Then for PowerPoint, there's this link I'm going to share in the chat that link should be able to help us get more information. It's the Microsoft support page for accessibility. For anyone who's looking to think about creating accessible content, it's going to really help you understand how to serve different disability clusters. So I'm going to share that link on the screen. And there's also a web content accessibility guideline as well. So I think just to save time, this will really help you improve your way of presentation, anywhere you are. Thank you.
Thank you, Rachel. Thank you all. Thank you all to our panelists. Thank you for sharing your experience and your input and knowledge around disability inclusion and all the work that you've been doing. I'll slowly finish, but I just want to ask one last time if you want to say anything, final words around disability inclusion of students in higher education, or if you have any comments that you want to share, and then I'll close. And if you don't have any comments, I'll close anyway. But yeah, can you have a comment?
Yeah, I realize that Constance's comments on channeling funds to support teachers. Yeah, I think that can really work. But I think also we need to expand our advocacy towards government taking the lead. Is the custodians of education or something. Like in my country, we have the government introduced inclusive education to the teachers training program, whereby it is mandatory for every teacher to learn sign language and braille to be able to interact with learners with those kinds of disabilities in classroom setting. But I think that is limited given the kind of disabilities and different type of disabilities that we have. So that's something that can be helpful, but also we have realized that it is not really that much helpful because they tend to misplace teachers, taking teachers to schools that do not enroll learners with disabilities at all. Yeah, so I think that's all I wanted to say.
Thank you, Kenway. Thank you for all your input. Any other last words you want to share? Okay, so basically we talked about our priorities. I think we could all align around awareness raising around disability and form of visible or invisible disabilities across the board, and awareness not only to empower disabled people but to empower all stakeholders involved in education, from teachers to caregivers to families to students. We mentioned a lot around, we talked a lot around peer support group that could be led by the institutions themselves, but also by students themselves, and mostly to share experience, to mentor each other, and to also understand the context that to introduce them to have a safe passage from secondary education to higher education. We talked about funding. We talked about investing in research. That would all of the things that I'm just talking about are feeding into the awareness highlight. So it's about investing in research, it's about making the research count, and most importantly, it's about monitoring and evaluation of all the system that we build around disability inclusion. Inclusive design, including the voices of disabled people and their environment, including them in the not only including them in the design, but also including them in the feedback and the sustainable aspect of the whole system. And we need to move on every level from being compliant or to acting as a ticking box exercise to being intentional. And for that, again, it's coming back to awareness. We need to raise awareness, and we need to invest not only money, but also our time and our efforts and our understanding into disability inclusion. That's what I got from this discussion, but if I missed anything, please do come in and add. But thank you all for your precious time this afternoon. Yes, Juliet, you have something to say?
And I just wanted to say you put it so eloquently and lovely, so thank you.
Thank you. Yeah, and it was a great discussion, and I'm so happy that I chaired this session. And hopefully we'll have more of those in the future, and we'll make this work intentional all together, hand in hand. Thank you all for joining, and thank you everybody for listening. Then I have to tell you that tomorrow you have a networking event at 10 a.m. UK time, networking opportunity through the same platform. And the next session is at 1 p.m. UK time, is on cultural diversity. So tune in and save the sessions that you want to attend, and looking forward to hear from the audience comments as well. Thank you all for joining.